Welcome to our continuing series of virtual voices. We are very honored today to have Dr. Philip Polakoff, the founder and CEO of Healthier We, who would discuss a very important topic, which will be introduced to you by our board member, Mariam Azarm. Mariam, over to you.
Thank you. Philip, thank you so much for accepting this webinar at short notice, because I know how busy you are. In any case, we're very privileged to have you here, so I will continue to introduce you. Philip is a consulting professor at Stanford University School of Medicine and affiliated scholar at Stanford University Bill Lane Center for the American West. Dr. Polakoff's career in health and healthcare spans 45 years and includes clinical services, product innovation, network development, care management, organizational and business enhancement, policy foundation, communications, and financing. Dr. Polakoff's previous positions have included being shortlisted for U.S. Surgeon General and Senior Managing Director of publicly traded consulting firms and advisor to numerous payers, providers, investors, employers, labor organizations, and public entities. Philip has also produced numerous health-related media productions, including videos being aired as Phil Polakoff Thrive Global. So Philip, you have the floor. Thank you so much for taking it.
Well, thank you so very much, and thank you to all who are attending. Special thank you for Christine and all her efforts over the years, and to Marian. I had the opportunity of spending time overseas for a period of time dealing with the issue of global health. We have a lot to cover today. The more interactive we can be, the better. And just as a bit of history, I come from immigrant families. My father was born in Ukraine in Shmolovitz near Chernobyl. My mother was from Belarus. In the process of what we're going to discuss today, we're going to focus on rural America. However, it could be rural any other country in the world. It could be rural Colombia, it could be rural Ukraine, it could be rural India. And I've had the good fortune of traveling throughout these countries for one reason or another. Was recently in Siberia, was in Colombia last year, and Cambodia, and Angkor Wat, and whatever else. So, and we want to hear from you. So it's your questions, no matter where you're at in your own career path. So if you're a student, you're the future leadership. And we really have to move from past to future rather than worry about the political divides that exist around the country. And we really have to be hopeful that we're going to get from crisis to sustainability and deal with passion and purpose. So it's going to be a real challenging time, but hope is on its way. And let me leave you with 3 words at the start. We approach everything with spirit, hope, and energy, and we do everything in a teamwork. So one of my partners is actually on the Zoom today, Denny Behrens, very important person. So the issue, let's go back to get to the future. So we'll put up the slides now, and then you'll all see this as very clear. And we take that communications has to be to the point, short and brief, and spoken in the language that you understand. So we'll go through this reasonably rapidly for the first part of the show. We'll try to interface it with global health, because having experienced issues around the world, they're somewhat similar, but keep in mind when you talk about rural, each rural environment has its own culture, its own issues, its own divides that it's crossing. So one shoe does not fit all. You really have to absorb the culture. And one of the key words that you'll hear today is you have to listen. A lot of us maybe talk a little bit too much. I'm from New York originally, so I tend to have a New York personality with a California veneer, or cosmetic surgery has been put on top of me, so it sells somewhat. So let's go to the next slide. This is adapted. In 1948, when the World Health Organization was formulated, they came up with an incredibly powerful definition. Rural health is a state of complete physical, mental, and social well-being. I inserted for one and all, and not merely the absence of disease or infirmity. Unfortunately, around the world, very prevalent in rural America, we focus on illness, and we focus on healthcare, but we don't focus on the word health, which to me is more encompassing and is representative of a lot of more issues that deal with the health of an individual. And you'll see them in another slide, whether it's the economy, the education, the technology, the cultural, the ability to listen, the ability to develop relationships. So in essence, this definition has not been lived up to either in this country or worldwide, in my opinion. So keep in mind, what I'm sharing is one person's opinion. I'm not saying it's shared by every other person, but it does have importance. Next slide, please. So these are the facts, and we're not going to go into a big depth dive, but we'll show you. Rural America represents about 20% of the population in our country. We have about 300 plus million people who live here, and rural is not just rural Midwest or rural Montana. It could be rural Maine, it could be rural South Carolina, it could be rural Mississippi, and this represents 40% of the land mass. And keep in mind, who inhabits this are either humans or livestock animals, and only 4% who live in rural America now is wildlife. So we've lost a lot of our wildlife preservation, which is also important worldwide. And it's also very important when we deal with the issue of climate change, that we have to preserve our natural resources in a meaningful way. The system in rural America is generally talked about rural healthcare or rural hospitals or rural clinics. Unfortunately, 172 rural hospitals have closed since 2005, and many are the states that did not enhance the Medicaid, Medicare support system. So you'll see the ones like in Mississippi and other southern states have a higher rate of closure than other states throughout. There's a real shortage of rural healthcare workers. One, there are not enough clinicians. Most of the primary care doctors are older, getting tired, getting burnt out. And there's certainly a shortage of the field that Christine, the founder of this great organization, comes from. Mental health workers are limited. The state of Montana, just to share this with Christine, has one licensed psychiatrist for the whole state. That's unacceptable. The state of Iowa is hurting real badly with mental health workers across the board. Another thing is, how do you communicate? It's interesting, broadband and internet connectivity is limited throughout rural. So how do you get the messaging out to the people in a meaningful way? It's interesting, Rwanda was the first one to use drone to get the chemicals in the blood, the pharmaceutical products, to the people in the rural area. So they're ahead of us in the United States. It's just started. North Carolina is using drones to get products to the people in the rural areas. So we really do have to have broadband, almost going back to where the rural electrification issue took place in the 30s during the WPA. COVID-19 is a story that's affected one and all of us in one way or another. It's sort of shown what was a problem before it came in, but elaborated on how bad it is. In essence, public health has been underfunded, underengaged for the last 50 years. Way back in my career, I was one of the first medical investigators for the CDC's institute called the National Institute for Occupational Safety and Health. And we traveled throughout this country. The first place I went to was Pine Island, New York, and deal with farm workers, into West Virginia and deal with the coal miners, out into the West to deal with the meat processing companies in Sioux Falls, South Dakota, and on and on. And COVID-19 has shown that we're understaffed. Many of the people in public health, primarily women, have either quit the job or were fired because they were trying to do something in the scientific community, and it got so politically oriented that those positions were either terminated or the people were forced to leave or they left on their own. And there's a growing rural gap in life expectancy. Unfortunately, when people talk about rural America and also rural any place else in the world, they deal with it more in a negative tone than a positive tone. So really, we don't look at the cultural history, how it's helped to create this country what it is. You go back and think about John Fremont and how he went across the country and mapped the country and what he found then in the 1840s and 50s and where we're now. And all the chronic disease indices are worse in rural America than in other places in the country. So you have a higher rate of heart disease, a higher rate of cancer, a higher rate of diabetes, a higher rate of obesity, a higher rate of suicide, a higher rate of dependency on drugs, the methamphetamine and the fentanyl issue is really having a major impact. And with COVID-19, you're not hearing as much about the addiction problems, but it exists. And all you have to do is look to the story that came out of Minnesota today at an Alina clinic where one person who had back surgery who was on opioids did some domestic terrorism there, killing people because of his pain and his addiction to opioid. Next slide, please. So those are some of the facts. We're going to move forward. Why take action now? We can't afford to delay. We have to move from crisis to sustainability, and we're laying the groundwork. So we're going to give you some actions. We're going to go through them rather quickly, and then we're going to show some initiatives, and then we want to hear from you with the questions. So just start if you have questions on anything I've said today. And as I told Christine and Marianne before, hopefully this is the start of our relationship, who's ever on this webinar, just the ending of it, because there's so much that has to be dealt with going forward. And it's only, and you'll see in the closing slide, it's only about we and us. It's not just about I and me. Next slide, please. So let's look at some of the actions that we have to consider to lay the foundation. We need better health that includes a focus on poverty, quality, equity, environment, prevention, accountability, and satisfaction. We can't just focus on physical illness. And we have to have all people engaged and have an integrated healthcare health delivery model where all the players are involved. We need that people have a right to health and healthcare. It's not a privilege. Keep in mind, the United States is one of the most costly countries in the world for healthcare, and it's a privilege. Who gets it and who doesn't? ACA was a start in the right direction, but mainly dealt with quality and access, more access to healthcare, but did not address the issues of better health, better quality, and patient satisfaction. We must examine the digital ecosystems and how they involve. That could be broadband, it could be internet, it could be the drone mechanism of delivering products to the field. So we have a ways to go in how we digital ecosystems and how it can be affordable for all and not just for the chosen few. Next set of slides, please. Next slide. So when we look at the next slide, we'll see some additional actions. Can I change the slide?
Yes. Yes, you did.
Okay, here we go. We need new ways to identify and use our whole rural health workforce. So they have to get integrated. And I would highly promote enhancing the role of the community health worker. Get them out in the fields and talk to people at their homes or in the pharmacy or whatever else. We also, one of the key words that's doesn't matter if it's our society or any other society, we really have to put a greater focus on future leadership. How are we going to train the students, how they're going to get paid, how they're going to be obligated to serve in the rural America. And we want to make sure they have a sense that they know the culture, they know how rural America works or any other place in the world, and that they're committed to spending quality time and put forth a passion and a purpose to helping the people who reside and where they work. So we really have to address that. And then we must also address what the role of the agricultural corporations are in this area, how they treat the people, how they treat the communities, how they treat the environment. And if you look at employment in rural America, and maybe hold throughout the world, I can't totally state that with total affirmity, is that the largest employer in rural America is the healthcare delivery system. The second largest is the government. And the third is, or education, government and education. And the third being agriculture. So all of these have to be involved in the future solutions, because what you hear a lot when you deal with rural America are the problems or the issues. And I think we all have to find success stories. And we just wrote a piece, when you look on our website, it's at the end of this thing, you'll see 3 success stories we put forth. One was Hispanic Native American community called Española, New Mexico. Another one was basically an African American community in South Carolina called Orangeburg. And the third was mainly a Caucasian white elderly community in rural Nebraska called Ord. And each one is addressing the problems in a community way. Each has a different culture, and each one is coming to the fact that until they commit at the community level, just waiting for the federal government to provide them resources will not get them to where they want to be today. They have to have better connections with the broadband internet. They have to have better connections with the local delivery of healthcare. They have to interface between the people coming into it, like a Walmart or a CVS, as well as their local clinicians. Next slide, please. So it's a long slide. As I said in the beginning, too many words is not really the way to present, but you got a lot of words on this slide. So you can read through it. The citizens of the nation, along with the healthcare system, payers, providers, must all address areas where people live, how many people live there, what their background is, what their heritage is, do an audit on what's currently being done and how they can get focus on what they can get done in a meaningful way. And these are traditionally called social determinants. I'm not so crazy about the words social determinants. I think maybe social perspective might be a better way to look at it. So these are foundational actions. Now let's turn to where we go forward. So a call to action. It's an ask, but each one of you are going to have to find the ask. So if we get to the next slide, you'll see the overriding support. Our present, national, state, and local times demand a new focus on leadership. We have to get the Gen Ys to work with the millennials, to work with the baby boomers, and unfortunately then there are people like me at the opposite end who are coming down at what we call the fourth quarter of life. So we all have to be engaged to make something happen. We have to, as we said earlier, move from past to future and try to be nonpartisan and come together because we all share some interests in common, although there are some that are different. How you pay for healthcare, who pays for it, and how much subsidy you get. And also we have to make sure that the federal government gets more engaged in a holistic way, an integrated way, rather than the silos from one department to the next, and how this interfaces with environmental climate issues. So we got a ways to deal with the local communities, the regional, the state, the national. And for the purpose of this conversation, we have to be involved with the global world too, because the World Health Organization is there. It's an incredibly important organization. We have to be involved in it, but they have to step up to a higher level too. So there are some issues with existing organizations. It doesn't matter if it's the academic institutions that I've been involved with or the larger organizations. They all have room for improvement, and they can take a look in the mirror and say, what are we doing right and what we can do better? Because there have been previous epidemics and pandemics that were handled, let's leave it at that. They could have been handled better, whether it was Ebola, whether it was Zika, whether it was anthrax, whatever it is. There's ways from our past prior to the last couple of years where we could have done better. Moving forward, so here's the way we see all the initiatives that all of you can find your space and your opportunity to engage with. Next slide, please. So public health initiatives, and I'm not saying these are in any one order of priority. They're all here on the table. We have to make sure that our local health department has more support, both in number and quality. We have to focus more on prevention, less on illness. I'm not saying we don't want illness, but if you look at healthcare budgets, the vast majority is spent on illness after the fact. And if we did more, especially for our youth, so a return on investment, if it was spent on the youth, we'd get a lot more preventing asthma, preventing diabetes, preventing obesity, and now preventing mental health issues, which are all too rampant and all too negative in what's happening. And then include rural in the definition of research. When we look at the digital initiatives, we have to expand rural broadband. I think we've seen some hope in how Starlink is sending out satellites. That's a part of the SpaceX endeavor in getting more digital into the West. Telemedicine has played an exceptionally positive role, but it has to be defined better. How are they going to deal with it? Who gets it? What's the quality? And I would put into this space also telemental health or telepharmacy or teledental. It goes on and on. The integration of healthcare across the board. I'm sorry, I can't see the last one. And a collaborative effort of bringing these people together. So these are some of the initiatives to start with. Let's move on to the next slide. So we got public health, economic initiatives. We really have to get this so we deal with rural regional partnerships. There's overlap. So one county may get something from another county, or one state may, rather than every state. And that's what we saw with the COVID-19. Every state dealt with the identification of the issue, the testing of the issue, the tracking of the issue, the prevention of the issue, the problem between making wearing a mask a political issue rather than a public health issue, the lack of a national focus that had meaning. And then we go into the partial success story about the vaccines. They're here now. How you get them, who gets them, how much they have. These all have to be answered. And hopefully we learn from these lessons and bring the academic community and the public community and the community of faith all more together in partnership relationships. Increase capital available and support systems for the seniors, because they're sort of really feeling isolated, lonely, and there's a lot of mental health issues that compounds the physical issues. The insurance initiatives, we really have to have rural input into the ACA revision. I think it could have been done a long part ago, even before the last administration. The previous one could have taken on, and we really have to look at better health and better quality at a lower cost. Opioid prevention and affordability, we don't have a success story there. Certain cities have been an absolute disaster with the rate of suicides, and same in the country. So somehow that has to be brought back into conversation and just not hear about COVID. We have to have health insurance that works for one and all. And the employer-based system, which came after World War II, has to be changed to a more modern model, because they have the issues working for any company. And now that you're working at home, that has another set of dynamics, good, bad, and different. So we're going to have to look at a new culture and how we're going to relate to it. Next slide. And hopefully we're staying on time, because I was given by Christine a 20 to 25 minute timeline to present words. So workforce initiatives, we really have to go back to where it was. And how do you have a National Health Service Corps? How do you provide some support to the education? How do you get more rural people from a rural background involved? Moving on to environmental initiatives, there's no question that climate crisis is here. There's no question that we have to absorb that into our rural lifestyle. Coming from California, we certainly have gone through our earthquakes and more recently our wildfires, how we're dealing with prevention. There's no question smoke creates air pollution, which creates problems for those who have respiratory and other problems. We have to make the focus on research models to protect and preserve our natural resources. We're losing control over some of our parklands. The Bureau of Land Management has an issue. Are we mining in certain parts of the country? Do we have pipelines to natural resources? So we got a lot of issues. So these are some of the major initiatives. And when we come down to the last few slides, we could get the next one. We have to be more entrepreneurial. We do really have to find a way to have more public-private partnerships, because right now most of the support comes out of the federal government, and the private sector, their lessons learned, entrepreneurial lessons, should be part of the training. And then lastly, the policy center. So we're of the belief that we should have a National Rural Health Institute. More will be on the way, because we have other institutes in the National Institute of Health, the National Institute of Mental Health, the National Institute for Occupational Safety and Health. It's our belief that we should have one that's totally dedicated to rural health. And that's using the big word health, not healthcare or illness. We got to get the land-grant colleges more engaged in this, both at the state level, the larger land-grant colleges, the universities, and then really look at and do assessments on what you're at, where you're at, and how you're going. So you have to have a passion and a purpose. And with that, let me close out with one slide or two slides, and then it's over. We're going to turn it over to you, and Miriam, to ask some questions. So in essence, as we move forward, I would put forth what I would call the 5 Ps leading to the 6. We have to address where we live and work. We have to have personal health that involves how you treat yourself, greater emphasis on prevention. So you do that starting early and go late. There are bicycle entities that you can ride on at home, or walks, or especially in this climate, walking outside with a double mask is better than sitting home watching the TV set. Population health, you have to look at all the factors that go into what one population's, how they present in their metrics versus another one. Public health needs a real transformation now. It's got to go back to where it is, with a lot more acceptability at all levels, at the local, the state, the regional, the national, and the global. And we have to find the political will to see this happen. So make sure that you engage your local political forces, the state forces, the national forces. I can tell you from my own experience, it's very important to have them hear you and listen and engage early on, because over time, across the board, it doesn't matter what their political perspective, the dollar figure, money becomes a major part of their will state. But I think really accomplishing change and transformation for one and all is very important. And hopefully this takes us to prosperity and health and away from illness and poverty. So with that, we put forth a one sentence that you can all use in whatever you want. So the last slide, I believe. In these times, if I is replaced with we, even illness becomes wellness. We can only work towards a healthier rural America together. So one and all of you has a role. You have to define the role is, you have to partnership on the role, but I'd say it's an opportunity to really be engaged in a critical issue at a time of pivot where more can be done. And unlike myself, who's giving you a lot of words in a short period of time, you have the opportunity to work in partnership, we or an us mode. And you're welcome to look at our website. It's called www. Healthy Rural America. And there are lots of academic papers there, and thought leader, and thought-provoking webinars, and videos, and audios, and the like. So we're trying our best to create communication and get actionable actions or doable actions in process. So with that, let me turn it back to Aaron, and then we'll open it up to questions or comments. You don't feel you only have to ask a question. Put forth your thoughts on it.
Well, Miriam, it's over to you.
Thank you.
You have the first questions.
Well, we do have quite a few questions here. At least I have them on my phone. One of them is, Philip, what do you think that this administration is going to do? Is it going to make a difference in the future of healthcare for the country?
I think that's a good question. Well, let me go back. Hopefully it makes a better future for health, not just healthcare. I think there are more issues than healthcare. They're going to address some of the pharmaceutical issues. They're going to address some of the public health issues, but they have to really work throughout the country. They cannot be East Coast, West Coast in orientation. They have to be more engaged in the public health community on the world stage. Their own organization, CDC, have to be more action-oriented than just data, because the academic institutions have to be more oriented, listening to the communities, not just doing research. So I do think there's a great deal of hope. I think the president put out his belief on rural America earlier in his campaign. So I have great hope. I know he's appointing some very good people. I know there's going to still be the politics between one side of the aisle and the other side of the aisle. I think that's the issue. I know there's going to be some concern about how do you deal with rural America. I know that if we're going to get things done, we're going to get them done sooner than later, because after July of this year, it's another campaign season for 2022. So I would like to see them make some definitive go show me stuff and get it done sooner than later.
So are you going to run for Surgeon General again?
No, they've already appointed the person for Surgeon General. I wish him the very best. I am willing to work with any organizations, whether it's World, what you do, World Information Transfer. I think it's really important that you play a vital role in getting the message out, whether it's our message, your message, or a collective message. I think you're really in a space. I think the United Nations, I can tell you, I helped put on the 70th anniversary of the United Nations in San Francisco a couple years ago. There was no 75th anniversary this year. I worked for some of the previous UN generals who I knew by name. I'm at a little loss, and I understand who's there now, but I haven't heard the word very much. So I would think the UN, if I'm going to take on the US government, I'll take on the UN. I grew up right next to the UN in New York City. My family's had a lot of the restaurants in New York. So I'm a big fan of the UN, but I'd like to hear their voice a little louder and clearer.
I think we all would, but one of the questions is actually about the right tax or government program that could make this work.
Well, we believe that creating an institute, the National Institute of Rural Health, in the Department of Agriculture would be the right place to put it. We believe that there's too much in the HHS now. There are too many different groups. They have a policy center, they have HRSA, they have the CDC, they have whatever. I don't know how integrated it is. And what I see wherever I go is people stay in their silo, and philanthropy should step up much further. Philanthropy puts out a lot of words, but I don't see the case studies that have been talked about that are success stories. I'm a great believer in metrics and outcomes. So if you start on something, you might have a different definition of an outcome or a metric, but have some that everyone can see that you're making progress from the day you start to the day you move on. And then the other issue is sustainability. Whatever you start on, can you sustain it so it doesn't come and go? So in essence, even with this webinar today, and this is not a challenge to Christine, my new best friend from New York, the challenge is, Marion, you already were there, so you're not a new best friend, you're a best friend. How do you take what's been accomplished here and the dialogue, and how do you get some feedback from the audience once we're off here to say, where are they going to play a role? So and you move this forward with whoever else comes on, said, we had this and we're doing this, just not one. I can't tell you how many Zooms we do, okay? My challenge is, what is definable action that comes out of a Zoom? Did you learn something? Did you meet someone new? I met Christine on this Zoom and others. Also, my partner's still on it. So Denny, who's a very close person in my life, and he'll ask some question, because if he doesn't, it won't be Denny. So whatever it is, so it's back in your court.
One of my scholarship recipients in Ukraine, and it's Marta Gnat, and this is the question. Thank you for a great presentation. The topic of coronavirus remains very relevant today. There are many opinions about how this disease will develop in the future and whether it will ever disappear. As we know, a new strain of this virus has been discovered. What do you think awaits us next? Will COVID become a seasonal disease like the flu, or another possible development?
Well,
so this is from a student.
Yeah, well, I think when I went to school overseas, in deference to the student, her question is better than my answer. The question has more thought to it than I can respond. Having been in public health, I don't have a definitive statement to render to the student. It's going to be a work in progress. There's hope now. The numbers are decreasing. On the other hand, the variants are showing up. So I would be more optimistic than pessimistic, but I'd also be cautious. I would not rush to live a lifestyle that you aren't aware that it could be COVID-19 pandemic this year, but there could be another pandemic differently next year. I think it's going to slow down. I think normal will never be the same normal that you remembered. So I think you have to adapt to the changes. You have to be optimistic to where you're going. So you can't just stay locked in, but don't go out there and like they had even after the Super Bowl in this country the other day. There was a victory, it was a happy event, and all the people forgot that there were public health issues and there could be a surge from that event. So I think to be hopeful, play a role, be optimistic, and don't go outside of a realistic comfort zone so you don't overly expose yourself to risk.
Now, thank you, Philip. And this is a question for me. You know, I have been putting the conferences on health and environment, global partners for global solutions now for 28 years. And they're all at the UN, and they're all attended by a lot of students. But one of the things that I completely agree with you, that we focus on illness, but there's a very good reason why we do that, because we have farmers that focus on illness, and also many physicians that they get many perks from the farmers in order to be able to advertise their products. Now, I know that personally because I was the CEO of Physicians Weekly for some time. And so, do you have any perspective or how we can get to that point? Because as long as we focus on selling the meds, then where is the focus on health and proper living and proper food and proper awareness?
FDA was passed. The reason it was passed is that they gave way to two senators from from Connecticut and New Jersey, and did not take on the pharma industry. I can tell you that for this to happen at all levels, you have to take on and hold accountable, because there's a good side of pharma and there's a bad side of pharma. So put much more emphasis and regulations and compliances and who's your FDA director and how you regulate these giving it that money. Because I was a practicing physician for many years, and they would take me out for A, B, or C. Eventually, and also I've been in the political arena, so I stopped taking their donations. I can also say there's some of that even in the hospital industry or in the physician community. So all of us who are in health have to step up with a degree of ethics and morality of how we're going to comport ourselves, okay? I think in your field, since you're such a sweet person, I think mental health has to be taken away from the fee-for-service model and put into the value-added model, okay? So people have to get paid for it so everyone should have a right to get mental health care, okay? I can tell you in my community, which has more psychiatrists than any other community in the country, Berkeley, California, almost 100% is fee-for-service, okay? That doesn't work either. So I think we really have to be fair in how we put new regulations in a more definitive way and have all step up. And I use the expression out of New York that didn't do me well in the West, either step up or step aside, okay? So I really do think you have to have this, and you have to have it expressed at the highest levels, whether it's by the head of the HHS. He can't come out of the pharmaceutical industry. That's where the last one came out of, okay? No. You got to get the people in the positions. And I think the person who's coming in, you asked me about the Biden administration, once he gets confirmed, Becerra has taken on the establishment pretty hard. He's taken on the monopolization of healthcare in Northern California. He's taken on, so that's great. He also comes from a Hispanic, very poor community in Southern California, which has had the disparity issue is really rampant on the COVID-19. So we got a lot to do. To answer your question very specifically, all of us have to step up, express ourselves, and go back, because maybe you and I first met at the Paris meeting on climate in 2000, I think it was 15. Yes. Okay, I was there with you. Okay? And I think that was a great hope meeting. There was a lot of hope in that meeting. And then all of a sudden, it went south. Yeah. So now we have a point. I can tell you the new heads of climate change are people I know very well, whether Gina McCarthy or David Hayes. So there's hope. These are people who have great skill sets and know how the government and the public work. So yeah, I'm more optimistic now. And I think we're going to see some changes with pharma that will meet your needs, because they can't afford the way it's been done. You have to have conversations that people feel they're engaged in. And I think sometimes, and I see that in the academic world, we have to come from the bottom up, not the top down. So we can't just think that as professionals with multiple degrees, we have all the answers to everything. And if we have a little, also, I'm really concerned, and Marion can relate to this, on equity. There's a few people are making more, and the vast majority are making less. So how do we level it out in any society? And we also have leaders around the world that there aren't too many world leaders who you hold up in high grace. You would say the woman in New Zealand's of high grace. You would say the woman in Germany did a good job. In this country, you give some B's, B pluses. So we really have to find a way to create some new leaderships across the board, get people younger, more engaged earlier, educate them better, and have them feel that they have some success stories and tell the stories. I'm a believer in telling positive stories. They don't sell as well in the news, right?
That's true.
But like the student from the Ukraine, she needs a good story to tell. So she'll have to tell her own story that's a good story.
I agree with you. That's very important. I tell that to my interns also, that they have to come up with their own stories. But I see that Mariam, over to you.
I think, Denny, did you have a question before I continue with mine? Because I know Philip pointed out that you would have a question.
Oh, I have lots of questions. I have few answers, but I have a lot of questions. Phil and I have been working together for a year. I think the issue for me has been rural is so badly understood because there's so many negative frames out there from which we perceive rural. In fact, you got rural people actually believing some of those negative frames. What COVID has really shown up in my mind is that, I'll call it the pipelines that we have for food, fiber, forest, all that stuff that you and I take for granted, how we're gonna, get our cereal tomorrow morning. We take that for granted because the past delivery models work really well. Well, when you've got a major interruption like COVID, it messes up those pipelines. And what it really shows is the inequity that exists for the people that are growing, taking care of, producing those commodities, the people that are processing those commodities, and then the top of the pyramid where all the wealth gets accumulated. So much of what's going on in rural America, I believe, could be helped by basically an infusion of capital and an infusion of trust in that the rural way of life is really pretty good. they actually have been able to take care of themselves. So, and what's happening, and Phil, I don't know if you want to weigh in on this. I think what we're about to see is a huge transformation, if for no other reason, that the population structure of the United States is rapidly changing. And I'm simply saying, so I'm a millennial, and there are more, or I'm a baby boomer, but there are more millennials than there are baby boomers. And they come to the table with a very different perspective on life. So Phil, you want to weigh in on that idea, if you all?
Yeah, well, I think Denny's right. And Denny's a special person in my life because we've worked very hard. Denny lives in Omaha, and actually Lincoln, Nebraska. And for last year, I met Denny after I gave a speech to 4,000 farmers last year. And when I asked them, the farmers, what were the major issues? Better health, better care, patient satisfaction. The one they've all voted for is lower costs. They can't afford the cost of healthcare. And trying to talk throughout this different things, and I teach at Stanford courses, I do this. It's really finding a common language between the Gen Ys, the millenniums, the older people, so they feel that we're all in the same space. And that doesn't mean we can have disagreement, but make it at least a civil disagreement, not fractional disagreement. So I think, we are in a transformation stage, but I can't say it's all going to be the way I would like it. But if I can get some incremental changes that are positive moving forward to achieve some of the metrics, and we're going to be pushing, we're going to use the videos, we're going to push it, we're going to push this National Institute of Rural Health. It's about to be released to get the politicians to at least listen to it, whether they buy into it. But I think if you hit the right time, and I do actually think this is the right time for change. I think people are really tired, exhausted, lonely, frustrated, exasperated, whatever it is. It's the time to move forward, step up, avoid your mental health deliverer. Don't go see your psychoanalyst. I can't get a smile from her. This,
Listen, I do a lot of charity work with the.
I just wanted to see if I could get you to wake up from hearing to me. So you got a great smile. It's a New York smile that's coming to life. So and you have to be honest with you, and I'm just not Christine, you have to have a little sense of humor. That's right. You got to have people feel that they're at the table. And you got to go to their table. Don't always have them come to your table. So we'll see. We put on a major summit 2 years ago called the Healthier Rural West Summit. And it was in Salt Lake City with a culture that's well known there. But it was a highly successful people where people came and networked. The question is, some of these events, whether it's this event or another, some would go to sleep after they're over. Whether it's going to Davos or whatever it is. How do you get this so it's got a passion and a purpose to move forward, that you can find something that's simple and elegant and get it accomplished? So that's, I guess, maybe when you get to my stage of life, you have to make sure that what you do has purpose and that you accomplish something. And don't ignore the private sector. Don't ignore innovation. Don't ignore disruptive technology. Don't ignore that there's some stuff that comes out of the pharma industry that's okay in the medical. On the other hand, there's a lot of stuff that's sold that doesn't really have purpose. There's drugs that are sold. There's supplements. There's cream that goes on your skin. Some of it does nothing for your skin. It goes on and on. There's devices. On the other hand, there's going to be more long-term dementia coming in. The numbers are going to go up. So if you look at Alzheimer's today, it's at 6 million in the US. It's going to go to 12 million. What are we going to do about it? Simple solution. I think parents should be given a tax deduction if they house their parents. Why shouldn't they be given? Why shouldn't? I've mentioned that politically. It still hasn't gone through. Why shouldn't, if you have older parents, or even give yourself something to support that? I think, and Denny's question is, we're on the road. We're going to have to pick up the pace to be on the fast track machine. For those who are into Peloton, we're going to have to, pardon my French, we're going to have to kick ass a little harder. Okay? We can't stay status quo.
Philip, you mentioned on the phone to me that you believe that social media like Twitter has a huge role in educating and just communicating with people today. And can you speak a little bit about the role of big tech?
Well, I think it's all, let me be honest, it's the good, the bad, and the ugly. So on a personal basis, I've used a lot of emails to communicate with people and even advertise your show today. Although it came out a little too late, I sent out 200 emails to promote what Christine's doing, okay? Because I believed in what you're doing. The response rate was like, when I sent it out for anything, slim to none. When I'm just telling you, slim to none. And I had to learn with this, and my wife, who's a very much of an overachiever, taught me that's yesterday's news. And she uses a line that I think is pretty good. She says, we've lived through the 20th century. That model was good enough for the 20th century, but we have to develop the 21st model.
Yeah.
Okay? We can't do where we're at. So we released something last week on what she showed. Exactly the presentation was showed. We put it up on LinkedIn and we put it on Twitter. And I can tell you, on the LinkedIn one, for what you saw today on this show, we had over 1,000 viewers. Just like that. Okay? We're going after this other thing on a trilogy. It's going up too. We put stuff up on Arian Huffington's on Thrive Global. It's just that you get more. I can't say you get enough feedback from what you put up, so I'm just being honest with you. You would like to have more interconnection, but you know that people are viewing this. I do a lot of podcasts now. I do webinars. I'm not looking to do this to be a revenue star, so I'm not a singer, whatever you call it, a young singer who's looking to make a living. But I do believe that on this program, you've held all your participants, okay? Everyone who started, you lost one person on the time we've been on. That's excellent. Because I've had some shows where it goes from X numbers to 0 numbers. So I think you got to put out the energy, because if you believe in your audience, you got to believe in yourself. And you really got to feel that it's their show, not your show. But you got to perform and practice.
So have you seen a change in the healthcare and the quality of healthcare since telemedicine started?
Yes and no. I think some people didn't have access to it are getting some, especially in rural America, because some of the people didn't have the transportation, they didn't have the emergency services. I think you have to, I'm a great believer that it can't be all transactional. It has to be relationship. So when I see Christine for my psychiatric care next week, I want to see her in person. I don't want to see her long distance, okay? And
M.P.H is in Florida.
That's right. And I'll learn something about Christine's warts, okay? It's not a one-way street. I think so. You have to be personable and engaging. And I think telemedicine is here to stay, but it's going to be defined a little bit more. It's going to be defined on second opinions. Because if you see someone who you don't know and they're doing telemedicine, can you really trust them? Who's going to pay the bill? So are they making enough spending the time with you? Do they know holistically, are you getting to see the dermatologist just for the pimple on the side of your face? Or are you getting them so they know who you are as a total person? Okay, on the other hand, concierge medicine, which I have to be honest with you, I'm part of, is a little bit elitist. So you get better service, better time, better quality, but you're paying a much bigger buck that the average person can't pay for it. So I think when you talk about telemedicine, concierge, these are all transformational issues that I think have to be from the bottom up and the top down. And the physicians. So if I'm to pick on the mental health community, and this has nothing to do with my new best friend, I think they have to step up and be more politically active. I don't hear the psychiatrist community talking on stage in Washington enough and about the mental health crisis going here. Okay, I think they have to put more energy out there. I haven't heard their voice. So if they're willing to take on pharma, look at themselves and take it. And Christine, that's not personal to you, by the way, when I make these comments. I just haven't heard the voice of the Psychiatric Association take on social issues strong enough.
Well, you haven't heard Christine.
No, Christine's she's my new best friend. And she also was honest about what she's frustrated with on several issues. She talked with all transparency and candor. But I think it's a little bit broader than just climate and healthcare. I think we got some a wide range that we have to integrate a lot of these issues for better health.
Well, you mentioned that there's only one mental health professional in Montana, and there's like 200 in Berkeley, California alone.
I said psychiatrists. I didn't say social workers or mental health workers. I said psychiatrists. Psychiatrists,
right? But is maybe it's a good sign that there's only one in Montana. Maybe Montana has a healthier population than
I would challenge you on that. I would challenge you. I think it has to do with.
Seriously, I was in Montana about 3 months ago, and everyone seemed like nobody was really affected by this change in COVID, and everyone was leading their lives like nothing had happened.
Well, go look at the numbers in South Dakota and North Dakota. They're the worst states in the country for COVID-19, followed by Mississippi and Louisiana. On the other hand, you see some growth in the political arena. The senator from Louisiana, give him his dues. He's gotten educated, and he's very articulate, and he's a physician. So I would rely on the future on a guy like the senator from Louisiana. I think he saw the light, drank the juice of reality.
I have another question from the student. Thank you for an excellent presentation. One of the facts that you mentioned at the beginning of your presentation is that more than 170 rural hospitals have closed since 2005, and hundreds more are at risk. Do you think that now, with more people reported to be moving out of urban to rural areas due to the COVID-19 pandemic, more attention will be paid on improving these rural health systems?
Great question. You got good students. I think there will
I
be,
do.
I think there will be a transformation in the type of health delivery in rural America. I think it'll be a hybrid of the past and the future. I think they're going to use more technology to bring in there. I think the rural health system has to improve its leadership quality, because I think some of the problems is that they were too short-sighted on the delivery of health. They were more interested in the transactional illness care. I think we got to get more people into the training institutions at all levels, whether it's nurses, physical therapists, occupational therapists, mental health workers, whatever, who have a better understanding of what it means. I think you have to make the work-life balance in rural America, because sometimes you go there with your significant other and you want to practice medicine, but the significant other is bored out of their mindset. So you got to make it so it's better. You got to look at this like one of the sports I used to do was crew, right? So I'd use that as a metaphor. You have to have something that works, and it's a team effort. You have to have a stroke, a leader to lead you, and you have to have 8 people pulling the oar in a synergistic manner.
Make sure it's synchronized. Yes.
Synchronized. Good word. Thank you. So that's it. I think there's going to be a change. How quickly it's going to change from place to place. One place is going to do it much better than the others. It depends. Is the community organized around this? Yeah. Also, can the healthcare professionals step up as a civic leader? Because keep in mind, when you and I started, I'm a little older than you, the family physician played a role in their community, right? Over time, they became just a part. They had their little office and stayed in the office and wanted to get the checks coming in. They weren't on the local civic council, city council, town council, whatever, commissioner. So I think you got to be involved. You can't just look in what's in it from you. But I think to answer your students' point of view, they're going to see transformation, and it's going to be herky-jerky. Some places will be better than others. Some states will be better than others. And the national government, if they can be clear with their message, which didn't come across with the COVID-19, and show that they really have a meaning and they're not just dictating and telling everyone how well they're doing with their programs, but being honest. This is what we do well. This is where we need some enhancement. And look at yourself, and also say it's okay to have failures. I can't tell you how many failures I've had in my life. Okay.
Thank you very, very much,
My pleasure.
Philip. That was a wonderful presentation, and
fun.
hopefully it will influence the people that heard it to make sure that they look at it on YouTube, so that it can be repeated many, many hundreds of times. And thank you, Mr. Danny Behrens. Thank you for joining us. And Marion, do you want to close our webinar with your friend?
Well, I think this was a really fun. Thank you so much, Philip. You made something extremely dry very, very interesting and fun. And I want to thank you for that, because I think you inspired quite a few international students from this webinar. I just want to say that next week, we're going to have the Assistant Secretary General of the Security Council on counterterrorism, quite a contrast, to join us. So hopefully you'll join for that too. Thank you, Christine.
Thank you.
Thank
Have a
you.
very good one. Take care. Bye-bye.
Bye-bye.